Hi, I'm Dr. Jason Ryan, cardiologist at the University of Connecticut Health Center, and welcome to Heart Talk, Living with Heart Failure, a video for patients and families. If you're watching this video, you or someone you care about has been diagnosed with heart failure, and I'm here to tell you that there's lots of reason to have hope. This is a very common and treatable condition, and there are a lot of things that you can do every day to keep yourself healthy and well. We'll go through all of that and more in this video series. Heart failure is a weakness of the heart muscle. The heart is a muscle just like any other muscle in the body, and its job is to squeeze thousands of times per day to push blood to organs that need oxygen. Part of the confusion over heart failure is that doctors use a lot of different terms to describe it. I've actually met patients with heart failure who've had the condition for many years and didn't know it because their doctors had always used other terms when they spoke about it. Sometimes you'll hear heart failure called congestive heart failure, pulmonary edema, fluid on the lungs, or retention of fluid. These are all different words we use to mean the same thing, heart failure. There are some common symptoms of heart failure that you should know about. These include having a hard time breathing, having swollen ankles, legs, or abdomen. Doctors and nurses will call this edema, and feeling very, very weak or tired.
I was having breathing problems and a lot of trouble sleeping. The breathing was especially bad whenever I tried to lay down and get any sleep. I just couldn't. I wound up sleeping in a sitting position pretty much, and it just slowly deteriorated to the point where I was so sleep deprived I was almost delirious, I think, by the time I got here. My ankles finally did swell. I seemed to carry most of the fluid around the belt line first, and then the ankles last. By the time it got to my ankles, I was pretty bad.
If you'd had heart failure 40 or 50 years ago, the condition would have progressed and gotten much, much worse over time. But that's not the case anymore. Nowadays, with a combination of medications, medical procedures, and surgery, we can stabilize the heart function, and in many cases, we can even make the heart stronger. It's important to know that heart failure is a chronic condition. It requires lifelong treatment. Heart failure never goes away. Once you have this condition, you're going to need to take care of yourself for heart failure for the rest of your life, whether you're feeling sick or feeling well. You should also know, if you have heart failure, that you're not alone. More than 5 million Americans have the condition, and it's one of the most common reasons people go into the hospital in the United States. So now we'll move on to the most important part of this video series, and these are the 6 tips for staying healthy. If you follow these tips and you do what your doctor tells you, you can lead a long, healthy, and active life. You should remember that with heart failure, much of the power to stay well is in your own hands. Do the right things and make the right choices, and you can feel well. Here are the 6 tips to follow to stay well with heart failure. Take your medications as prescribed, go to doctor appointments, monitor symptoms and weight, adapt diet and fluids, get exercise as directed, and limit your use of alcohol, caffeine, and tobacco. In this video series, we'll go through each of these 6 tips and talk about why each one is so important. The first tip is to take medications as prescribed. You should know that if you have heart failure, your medicines are necessary whether you're feeling well or feeling sick. Like I said before, modern medicines keep the heart stable and strong even when you're doing okay, so you shouldn't stop your medicines just because you're feeling well. You can help yourself take medications as prescribed by following some simple tips. First of all, review your medicines carefully with your doctor or nurse, and make sure you understand how and when to take them. Heart failure medicines are complicated. You may have to take pills multiple times per day. Make sure you know exactly which pills to take and when. Ask your doctor or nurse about side effects or interactions with other drugs. If you ask about this ahead of time, if you experience any side effects, you won't be caught off guard and you'll know what to do. Make sure you have a way to get your medicines. You should think about how you're going to get to the drugstore, especially if you don't drive. One of the things I hate to see in my own patients is that they aren't taking their medications because they weren't able to get a ride to the drugstore to pick them up. You should know how to refill your medicines. Don't wait until that pill bottle is entirely empty to call your doctor and say that you're out. Unfortunately, I've sometimes seen my patients get sick because they run out and aren't able to get a refill in a timely manner. Call your doctor's office early before you run out of pills. This next point is very important. Bring your medications or a list of your medicines to your doctor's appointment. I tell all my patients to just scoop all their medicines into a brown paper bag and bring them with them. It's very important that your doctor knows exactly what you're taking, and if your doctor thinks you're taking something that you aren't, this can lead to you getting sick. And finally, notify your doctor if you experience any side effects. Most side effects these days are treatable with some simple changes to your medicines. Unfortunately, I sometimes see patients stop medicines because of a side effect, and this can lead to getting sick. Don't let this happen to you.
First thing in the morning, I generally set my medications up for the entire day. There's some pills that don't necessarily get along with others, so some get taken later in the day rather than early. There's vitamins that I choose to take in addition to the pills that you give me, and I just try to split them up so they're spread out over the day. Take maybe 2 or 3 times a day. I'll take pills.
So remember, patients who take their medicines live longer, feel better, and spend less time in the hospital. The next recommendation is to go to your doctor's appointments. Heart failure is not simple. It requires taking lots of medications to stay well, and there are a lot of things your doctor needs to check to make sure you're not starting to get sick again. You should never, under any circumstance, miss an appointment with your doctor. I often tell my patients better to have a boring visit with me in the office than an exciting visit in the emergency room. Here are some tips on how you can make it easy on yourself to get to your doctor. First of all, set up appointments before you leave the hospital or other facility. If you're leaving a healthcare facility, you should have a card in your hand with the date and time of your follow-up appointment. While you're in the facility, nurses and other staff can help you make sure you get an appointment. Don't wait until you get home to call the doctor's office and set it up. Also, set up the appointments on the best day and time for you. If you set up an appointment on a day that's hard for you to get there and you miss it, this could lead to you getting sick. And finally, just like with the medicines, make sure you have a ride. This is especially important if you don't drive. You need a way to get to your doctor's appointments. When you go to your doctor's appointments, bring a friend or family member. There's a lot of information that your doctor's going to share with you. It's hard to remember everything, and 2 heads are always better than 1, so having someone there to advocate for you is a very good thing. Also, like we said in the last section, bring all your medicines or an accurate medication list with you to the doctor's appointment. And finally, don't be afraid to ask questions. Your doctor's there to help, and remember that with heart failure, a lot of the power is in your hands to stay well. If there's something that you're confused about or something where you need more information, speak up and get the information you need. So just like with medicines, patients who go to their doctor's appointments live longer, feel better, and spend less time in the hospital. The third recommendation is to monitor symptoms and weight. Remember the common symptoms of heart failure. These include having a hard time breathing, swollen ankles, legs, or abdomen, that symptom that doctors call edema, and feeling very weak or tired. If you experience any of these symptoms, you should let your doctor or nurse know right away. Weighing yourself is one of the most important things you can do as a heart failure patient to keep yourself well. When your body starts to hold on to extra fluid, your weight will go up. And we've found that the weight gain from fluid can actually start up to 2 weeks before you feel sick and have symptoms. So by weighing yourself every day, you can avoid getting sick. I tell my patients the scale is like an early warning system. It gives you a heads up that you're starting to get sick, and it lets your doctor intervene before you get so sick you need emergency room care. Here are some tips for how you can make it easy on yourself to keep track of your weight. First of all, get a scale if you don't have one, and make sure the scale that you have has numbers that you can easily read. You should keep a weight chart every day, and I give all my patients a calendar weight chart where they can write down their weight every morning, and then bring that weight chart to your doctor. My patients who bring a weight chart to me make my job very easy because I can quickly assess how they've been doing since the last time I saw them. You should weigh yourself every morning at about the same time, after going to the bathroom, before you have anything to drink, in the same amount of clothing, and using the same scale. By doing this the same way every day, you'll ensure that any changes in your weight are due to fluid and not due to other reasons. Notify your doctor when you gain 3 pounds in one day or 5 pounds in 1 week. These weight increases are too large to be from anything but fluid retention, and by letting your doctor know, your doctor can do something about it before you start to get sick.
I was told not to gain more than 3 pounds overnight and 5 pounds in a week. and to weigh myself every morning. So the first thing I get up in the morning, I weigh myself. And the weight control, as long as I stay away from the salt, is pretty good. It stays fairly stable. I can't keep it as low as I manage to get dried out to when I'm in the hospital, but it seems to stay pretty steady at home. And when it goes out of bounds, I call you.
It's complicated to keep track of all the symptoms of heart failure and the weight, so we teach our patients at the University of Connecticut to self-manage by teaching them to follow the zones. And we'll go through this zone sheet right now, but the bottom line is you want to determine each day whether you're in the green, yellow, or red zone, and based on what zone you're in, you'll know what actions to take. You're in the green zone if you have no shortness of breath, no weight gain of more than 3 pounds per day, no swelling of the feet, ankles, legs, or stomach, and no chest pain. The green zone is where you want to be. Hopefully, you'll be in the green zone most days. And when you're in the green zone, you should keep up the good work, take your medicines, eat the right diet, and keep weighing yourself every day. You're in the yellow zone when you have a weight gain of 3 pounds in one day or 5 pounds in a week. You may have more shortness of breath, more swelling in your feet, ankles, legs, or stomach. You may feel more tired or have new or unusual coughing. You may be dizzy, and you may find it hard to breathe lying down. You may even need to sit sleeping in a chair. If this happens, you should notify your doctor or nurse. When you're in the yellow zone, you're starting to get sick, but you're not so sick yet that you need to go to the hospital. Your doctor or nurse can intervene and help keep you well and keep you at home. You're in the red zone if you have a hard time breathing, if you're struggling to breathe even at rest, if you have chest pain or discomfort, or you're feeling faint. This is a situation where you may be having a medical emergency. You should call 911 and get help or go to the emergency room. So I teach my patients to check every day after they weigh themselves what zone they're in, and based on whether they're in the green, yellow, or red zone to take the appropriate action. By doing this, you can self-manage your condition and keep yourself well. So just like with the other tips, by monitoring for symptoms and weight gain, heart failure patients can feel better, live longer, and stay out of the hospital. The fourth recommendation is to adapt diet and fluids. Salt and sodium are the same thing. Some people aren't familiar with the word sodium, but it's important to know what it means if you're going to monitor how much salt you eat every day. High salt intake makes the body hold on to extra fluid, and extra fluid leads to the swelling and heart failure symptoms that make people sick. So by eating a low-salt diet, you can stay well. Here are some tips on how to avoid eating salt in your diet. First of all, don't add any salt to meals. This is probably one of the easiest changes you can make to your diet to help reduce the amount of salt you eat every day. I tell my patients to set a goal of eating less than 2,000 milligrams a day of sodium, and to put this into perspective for you, 1 teaspoon of sodium is 2,300 milligrams. If you don't buy and cook your own food, make sure you speak to the person who does. Let them know about your heart condition and that they should make a low-salt diet for you. You need to know how to read the label if you have heart failure in order to monitor your salt intake. Let's take a look at this label on the screen right now. Notice that it says that the food in this package has 190 milligrams of sodium. Now, I said you should eat less than 2,000 milligrams per day, so you might think that that means you can eat this entire package and only consume 190 milligrams of sodium. However, if you look at the top of the nutrition label, it says there are 12 servings per container. That means if you eat this entire package, you would actually eat 12 servings of 190 milligrams of sodium, and this would be way too much salt for one day for a heart failure patient. If you're confused about nutrition labels, talk to your doctor or nurse so they can help you understand them. It's a very important part of self-managing your condition as a heart failure patient. Here are some very common sources of salt in the diet that Americans eat. Canned foods are loaded with salt, so are frozen dinners, deli meats, and hot dogs. If you eat a lot of these, you are going to eat too much salt, and this will lead to the symptoms of heart failure. Some other sources are listed on this screen. Sea salt has salt in it. Even though it says it's from the sea, it doesn't mean it doesn't have salt in it. Adobo seasoning is a food seasoning used in dishes of Spanish or Caribbean origin. Salad dressing, cheeses, and soy sauce all have salt in them. Jar tomato or pasta sauce has lots of salt. So do pickles, sausages and kielbasa, ham and bacon, and French fries. You should minimize how much of all these foods you eat if you have heart failure. Now, having done this for a number of years, I know that there are a lot of people out there who find it very difficult to eliminate or cut down on the salt in your diet. If this is the case for you, all is not lost, but you should tell your doctor what you're eating. If I have a patient who's eating a fair amount of salt, I can adjust their medications, I can follow them more closely in the outpatient setting, I can help keep them well even though the salt is in their diet. So be honest with your doctor. We're here to help, and there's a lot we can do even if you can't get the salt out of your diet as much as we recommend. Eating out is where a lot of heart failure patients get into trouble. A very common scenario is for a heart failure patient to go out, maybe have a meal of salty food, maybe Chinese food, and a few days later find themselves swollen and in heart failure. You can avoid this by making good choices when you eat out at restaurants. First of all, choose baked or broiled foods whenever possible. If you eat salad dressing, sauce, or gravy, ask for it on the side so that you can minimize how much of it you eat. And choose safe dishes like baked chicken or fish or steamed vegetables. These tend to have less salt. So remember, by avoiding salt in your diet, you can feel better, live longer, and stay out of the hospital.
We almost don't eat any manufactured or processed food in the house at all anymore. Virtually all meals are made from scratch. We grind our own flour from grain. I bake all my own bread, so I know what's in it. And we sort of stay away from canned foods. It becomes a label reading experience to read all the labels and find out just how much salt is put into manufactured foods. They're virtually off the list of possibilities if I'm going to restrict salt intake at all. To me, the very first, most basic thing is when you go food shopping, you have to learn to read those labels. There's such a huge amount of salt and sugar in processed foods. I think when you start to read those labels, it really scares you. You wonder why that's even allowed.
Sometimes the doctor has to limit the amount of liquids a person with heart failure can have every day. This is something that we call fluid restriction. If your doctor recommends this for you, you're going to need to keep track of all the liquids that you eat. You also should know that some foods count as liquid, foods like yogurt, pudding, ice cream, and Jell-O. Also, some fruits have liquid in them. For example, 1 orange or half a grapefruit has 4 ounces of fluid. You should space out your liquids over the course of the day and save liquids to take your medications. Also, some patients can take their medicines with applesauce instead of a drink. Here are some tips you can use to battle thirst if you're on a fluid-restricted diet. You can use ice chips or rinse your mouth out. You can freeze juice in an ice cube tray. You can use a lemon wedge, gum, frozen grapes, strawberry, or hard candy instead of drinking. The 5th recommendation is to exercise as directed. The first thing it's important to know is that activity levels need to be determined by your doctor. There are some special cases where heart failure patients shouldn't exercise, and if this applies to you, you need to avoid exercise. However, for the majority of heart failure patients, exercise is safe and actually good for you. I've met a lot of heart failure patients over the years who think that because they have a heart condition, they shouldn't exercise because they know that exercise can stress the heart. But the reality is that for the vast majority of heart failure patients, exercise is good for you. A lot of my patients also ask about sex and driving. These too are usually okay for most patients, but you do need to check with your doctor because there are special situations in which these activities should be avoided. The last tip is to limit alcohol, caffeine, and tobacco use. You should check with your doctor about alcohol and caffeine use because just like with exercise, there are some very special situations where these substances need to be completely avoided. However, in general, alcohol and caffeine are okay in moderation. You can usually drink alcohol less than 2 drinks per day for men or less than 1 drink a day for women. And caffeine is usually okay as long as you drink less than 1 or 2 cups per day. Tobacco is definitely out if you have heart failure. If you smoke, please stop. Smoking is bad for anyone, but it's especially bad for those with heart failure. It makes your heart work harder and it can lead to heart attacks. You should ask your doctor or nurse about help to quit smoking if you need it. It's one of the best things you can do for yourself if you have heart failure. So let's review the 6 tips to stay healthy with heart failure. Take your medications as prescribed, go to your doctor's appointments, monitor symptoms and weight, adapt diet and fluids, get exercise as directed, and limit alcohol, caffeine, and tobacco use. Remember what I said at the beginning of the video series. Much of the power to stay well is in your own hands if you have heart failure. Take control of your disease, manage things appropriately, and you can stay well and live a long, healthy, and active life. Thank you very much.